Hello, I'm David and welcome back to another First Aid Skills video. In this week's video, we're going to be going over checking the person. Last week we went over checking the scene for safety, but now we're going to go over how to check the person. So everything's good, we've come up to them. The first thing we want to do is assess their level of consciousness. Now if the person's talking to you, obviously they're conscious. But if they're not talking, you want to figure out what level of consciousness they're at. So the way we do this is you come up to the person, you typically want to introduce yourself, say your name. If they don't answer, still cameras around, the public watching, it gives off more of a kind of professional vibe, like you know what you're doing, you're not just some stranger coming up to them. So you go up and you go, hello, my name's David, can you hear me? You want to talk in both ears because they may be deaf in one ear and they may not just know you're there until you talk to the other one. And you want to go up and we want to tap their shoulders. And if they respond to that tapping, then they're somewhat responsive. So we go like this. We come up, hello, my name's David, I'm a first aider, can I help you? Hello, can you hear me? Nothing. So if you get no response, the person is unresponsive. So the next step we want to do now is we want to do what is the primary assessment, which is our ABC. So airway, breathing, and circulation. So to check the airway, we want to make sure the airway is clear. If they're talking, their airway is clear. So we want to do what's called a head tilt chin lift. So we want to put our hand on the person's forehead, the chin or fingers under the chin, and we want to tilt their head back. What this does is if they're unconscious, if their tongue was laying over the back of their throat, blocking their airway, now that we've lifted their head, it pulls the tongue out of the way. So now their airway's open. So now we want to check their breathing. And how you check breathing is you put your ear by their mouth, and what we do is look, listen, and feel. So we're looking at the chest to see if it's rising and falling with their breaths. We're listening for breathing sounds, and we're feeling on our cheek for any breath coming out. So you want to look, listen, and feel for 5 to 10 seconds. Okay, nothing there. So if you feel breathing, then they're breathing. If you don't feel it, then they're not breathing. Now, there are forms of good breathing and bad breathing. There's one that we call agonal breathing, which if it's like every once in a while they do a big gasp for air and then they don't breathe for a while, and then another big gasp or intermittent wheezing, that's not proper breathing, so that would be considered not breathing. Now, to check so we went over airway, A, breathing, B, C, circulation. So the way we look for circulation as first aiders is just a general overlook of the body. We're looking for skin color. If it's normal, then they have proper circulation. If you don't see any major bleeds, like there isn't big pools of blood and you can see that there's a wound, then that's kind of what we're looking for. If there is a big bleed, we have to take care of that because someone that is bleeding that much will not survive if they continue to bleed, so we have to take care of that. So yeah, there's our airway, our breathing, and our circulation. So that's how we check the person. So next week, we're going to go over call. So the proper way to call 911, when to call 911. So thanks for tuning in for this week's video. I hope to see you all next week. Thank you.